have to be a bit hasty to make sure that we...
Just a minute. Bado profesa.
Sawa, tayari? Are you ready?
Sawa.
Is it that?
Yes. No. No. Okay. Once more. Thank you. Thank you. Asante sana.
Will be breaking for lunch as where we had the number of tea. There's going to be a joint response. And then we have Deputy Director Abibuyo. Our installation center. And then we have Alberta, who is in charge of surveillance team. We have Sarasara, who is in charge of neglected tropical disease. I want to use the opportunity first to welcome the group of the team, the County Director. Thank you. Thank you very much. Okay.
You have the capacity, so what we need to do is to buy RTGS so that we can
People in and the law requirements shine for Thank you, CEO. Thank you, Mr. Jones, Your Excellency, the Governor, our guests, members. We also have our flag, our head of flag, Jeffrey.
for the facilities. This is very important. When I think COVID patients, we need oxygen supply. We for 4 hospitals, they have 52 isolation beds and 13 ICU and HCU beds, coming to a total of 65. For Kina, they have 5, and including the ICU beds, we have 117. And the team on the ground, led by the coordinator from
Last step to start because of time. What's the just start today? We have
na muendelee kuchunga afya yetu. Asante.
We have for the 4 hospitals, we have 3 all facilities have personnel except one, which is for the Russia, and I think that that will help and ensure that we have a system there. And among the FF stations, so sensitize them on the public of COVID-19 measures as well as giving updates and countering this information. And that's
Have a working health centers. Probably you can upgrade those dispensaries to that level so that we don't burden the referral hospital for patients.
The issues of supply chain when it comes to medicine and availability of drugs within these hospitals to make sure they were there. We're also looking the existence and looking how well you are managing testing. In case you have a patient here, in case you are dealing with the testing, how well you are prepared in terms of testing in these particular hospitals or within the county. We are also looking risk management, and the risk management was key to us, how you are preparing for unknown to make sure you can deal with this epidemic. And also, finally, we're looking at the areas of financing to ensure the funding, the funds are going to these particular areas, and how you are prepared in terms of making sure you have the right budget to deal with this pandemic. Your Excellency, let me summarize this, because the experts will be able to go in depth, will be able to provide specific happenings in those particular hospitals which we picked, 10 hospitals. But let me say, the first one, in terms of scoring, coordination, how well you were coordinating these efforts. Your Excellency, let me tell you, the team is pleased to tell you, out of 15 points that were allocated, Your Excellency, you scored 15, maximum. That shows how you are prepared well, your team were trained, the coordination was done well, and we had evidence to back our findings. The second one was emergency response mechanism, how you are prepared to respond to emergencies. Your Excellency, again, the score, maximum score was 10, and good news, you scored 10 out of 10, and that was excellent. Number 3 was essential medicines that was needed to be in these particular hospitals. Your Excellency, the score we gave there was 5, and you scored 5. We found the evidence of medicine and drugs in those stores, and we are very happy to report that finding. The other one was case management, and our team, they visited these hospitals, and each hospital that we visited, the maximum score for that one was 20, and Your Excellency, you scored 16. So you are missing 4 points, but that is also very good. But there is a room for improvement in terms of case management. We'll be able to go through this to see which hospitals we are performing better than the others, and some areas of improvement in that area. What we'll be doing immediately, and other areas of improvement, our team will be meeting with the governor's team so that we can be able now to work on mitigation plan. We have a model plan on ideal situation, assuming every hospital here we have high cases. That is what we'll be looking, those risk mitigation plan, all the risk management plan, which will be able to work with the county government, with our experts here, so that we can be able to develop a plan for the overall county and specific hospitals, which we'll be able to undertake. And so this is going to start beginning tomorrow. We'll be able to schedule a schedule with the governor's team, and then we'll be able to undertake this. And remember, now we have about 90 days, so within the 90 days remaining from 120, so we'll be able to ensure we have a risk management plan in place, and some other areas where we need to bring the issues and the rating up, so that when we leave this county, we can say this county can manage effectively all the cases that can happen here, and there will be no transport of patients from this county to another county. Your Excellency, also testing, laboratory testing, the maximum score. We knew the challenges that you are facing. You are working on this, but you are turned around, and now you are working to get the samples from Isiolo to Nairobi to other areas that you are taking this is very commendable, because you don't have a laboratory within the county. But that preparedness for you, it is you scored 16 out of 20. 16 out of 20. There's areas of improvement, but we appreciate that. The other one we looked was risk communication and publicity, and that one again, we out of 20%, you scored 17, and that is also very commendable, and that is a good job for that one. The other one is risk management, and risk management, Your Excellency, you needed to ensure you put a plan, and when our team went through, we did not find that plan. We will still be working with your team to ensure you can have a plan in place so that we can be dealing with the risks, the issues of tomorrow and unknown, to make sure we can be able to deal with them. We have a good model so that we can be able to work with your team to establish the same. But the risk management plan is an issue whereby we have to work on that. Then the other issue we looked was finance, the budget towards COVID-19 and the cost management of the same, and how well you are prepared in this. And Your Excellency, out of 5 points that we allocated in this particular category, you scored 5. And that we felt was excellent because you did not miss any point. So, Your Excellency, we are going to go specific areas here.
They fill the gaps that are left so that next time round we score 100%. Some of the areas we can easily score 100%. The fact that the patient information, the CADEX, is a very easy thing. And I'm sure hapo tungepata hiyo max 5. Kwa hivyo hapo kidogo kidogo tutajaza ili next time ukirudi tunataka kuwa 100%. Mumeona it is one of the county with oxygen plants at the county referral facility and even at the sub-county. And we are going to put even another one at Merti and at Oldonyiro so that all the sub-counties have oxygen plants so that the issue of oxygen will be taken care of. I know the politics of oxygen plants is big in Isiolo, watu wanasema tumeiba, lakini hiyo oxygen hata ilipimwa, imeangaliwa 98% purity, according to the experts who came from the medical engineering teams that came here. So, mimi nataka kusema hii 85% ni kwa sababu ya mpangilio ile sisi tumeweka. One area that I challenge this team is you did not, and I think even at a national level this is a failure, that the issue, the role of community health volunteers in prevention, in contact tracing, has not been highlighted in this assessment. We have actually put as our first line defenders 703 community health volunteers who are visiting every household in this county. Every household in this county today has a designated community health volunteer who takes care of that homestead to ensure that immunization in that homestead is 100%. Maternal care in terms of visiting antenatal clinics is minimum 4 times during the pregnancy. That deliveries happen in the hands of a qualified health personnel. That health education is given priority as a method of preventing diseases so that people know about diseases, how it is spread, and therefore how to prevent basic issues of hand washing after eating, or before eating rather, and after visiting toilet. And those basic things can prevent disease a lot. Program we are in when COVID came, and we converted those community health workers to be our first line defenders in terms of spreading information about COVID, how to prevent COVID, the issue of hand washing, the issue of social distancing, the issue of wearing face masks and all the health, following the Ministry of Health guidelines. So I think it is deficient when this assessment does not put that into consideration, because it is actually the first line of defense. So I want you to take this message, Chairman, so that in the next assessment, that also becomes one of the parameters to be assessed. But I would like to say that is actually our strategy, that is actually the referral system number one, isn't it? It's in the referral system, that is level 1, isn't it? So you must look at level 1, you must look at level 2, level 3, level 4, all the way to level 5. So you avoided a very crucial component, which is level 1. I think that is actually related also to contact tracing, which is a very critical management for COVID-19. How is the county prepared to do contact tracing and the follow contacts of positive cases? That, I think, should have been a parameter to be looked at. Well, I would like to highlight on the areas where we were found to be a bit deficient, the issue of mortuary in the sub-counties. I think because of our religion, most of the people in the rural areas are Muslims, other than here in Central. So I think, but still, I think the issue of body preservation is important. We have taken that very seriously. Accommodation for health workers. I don't know whether why you did not pick that, because we have hired a hotel called Grande Hotel for those who are working at the isolation center at Isiolo referral facility. We do not have accommodation for the others in the sub-counties and other lower facilities, but we have a hotel. We even have divided the hotel into two. One side where negative workers who are just working at the isolation live, and then another wing of the same hotel we have designated for staff who eventually become positive, so that they can be isolated and managed away from the isolation centers, because that was actually their request, and we have succeeded in getting that kind of isolation for health workers. So the disease now is rising, and we need to really put the people on alert and let them know that we are still with them. Let them also know that the disease is rising, and if they have been doing social distancing, it is needed more now. If they were putting on face masks, it is needed now more. We have put a lot of hand washing facilities. That's the other area which you could actually have looked at. How are the markets and public places being prepared through hand washing stations? Availability of hand washing stations should actually also have been your other area of, because we've really, between ourselves as county government and also donors and well-wishers, we have received a lot of water tanks and made hand washing stations out of them. We have actually even the issue of taking care of the street children. We have removed all under 18 street children and based them in a school somewhere, accommodated them there, feeding them there away from the town, so that they don't also fall sick and infect others. So those are also the kind of efforts that we have put in place, which needs to be highlighted, since we were doing a comprehensive preparedness of the county. So those are also the kind of comments you need to go back to, so that you also improve your own indicators or parameters. You can add more parameters, and those are the things that we are doing as a county.